So emergency and crisis care really didn't have a differentiation in any of the historical records from the 1850s or the 1880 hospital or the early 1900s. Emergency crisis care was just part of the spectrum of care that was provided. Sometimes having patients admitted to mental health hospitals was done involuntarily and typically appropriately. But by the 1970s, there was an increasing national attention that maybe not all involuntary admissions to a mental health hospital were appropriate.
As far back as the early 70s, there was an acknowledgement that you probably didn't need all these folks to live in a hospital. In fact, there's a January 17th, 1973 report that essentially says of the 1,300 or so people that currently are in the hospital, about 900 of them could easily be served in the community with appropriate resources.
And in 1976, there was a legal case in Milwaukee that was actually a watershed legal case nationwide that really defined that better than ever before and made the restrictions or the requirements higher. Those requirements included that a mental health facility, at least in Milwaukee County, had to be able to prove within 24 hours why emergency or crisis patient involuntarily admitted should be retained involuntarily. A regulatory change in 1976 coincides with Behavioral Health Division creating their emergency and crisis care offering, which was now restructured around that regulatory requirement that they would have doctors on staff and ready to make evaluations very quickly now within that 24-hour window.
The original hospital units were more or less designed as sleeping rooms with the services, for the most part, delivered throughout the grounds. Most of the patients really, as long as we had long-term care, which lasted until 2015, most of the patients would have had off-ward privileges and would have been able to move around the complex. That experience and the success of managing those cases really sort of opened the door for that community-based system of care that we are embracing today. The idea that if some support services are there in times of crisis or in times of really acute need, that once someone sort of gets back on their feet, they don't need a whole lot to be successful in the community. And really, if you provide those things that individual wants, the parlance of the day today would be person-centered care or client-driven care, that if you listen to what people are asking for and you provide those things for them, they actually have an opportunity to flourish.